is a Wednesday morning, and that means get to your doctor visit. Don't cancel. It's time for us to go there. Dr. Stan Anderson is on our WHBC Newsline this morning. Good morning, Dr. Stan.
Hey, Pam. Great to talk to you.
All right, so let's start out with Parkinson's Awareness Month. That is the month of April, correct?
That's correct. And so this whole month, one of the interesting things is that you're starting to see some public service announcements. You're starting to see some things that are about it. So there's a couple of things. Parkinson's is a neurodegenerative disorder. It basically affects dopamine, and it's the neurons in specific areas of the brain called the substantia nigra. And the symptoms develop gradually over years. It's a bit different from one person to another, so it's never the same. But the main symptoms, the early signs of Parkinson's disease, is a tremor. The tremor is more the shaking, tends to be more at rest, and oftentimes it's in the finger, hand, or chin, or thumb, and then it affects other parts of you. You start with constipation. That starts to get a little bit worse. You start having a little bit more trouble with sense of smell, and then sleep is affected. And you're just not sleeping as well, or you start acting out your dreams. And then there's trouble with movement. So your move is a lot more halting, or it's a lot more sluggish, and you're just stiff. That's the simplest way to think of it. And then your handwriting tends to get smaller. So instead of writing as large as you did, tends to be a little bit smaller. Your voice oftentimes changes, and you tend to have a little bit more of a soft or a low voice. And then something called masked faces, where your face doesn't have as much character to it. People oftentimes say that you look mad, or you look depressed, or you look very serious. And it's part of the process of Parkinson's. And then you're dizzy a little bit more unsteady on your feet, and you start to hunch over. So those are some of the things that happen. They tend to occur more commonly as we get older. If it occurs before the age of 60, it's called early Parkinson. If it occurs later, then it's typical Parkinson's disease. Part of it is just being aware, getting in to see your healthcare provider early enough so that we can start you on medicines that will help you to end up having better control. As of 2024, there is no cure. About 1 million people right now are diagnosed with Parkinson's disease, and it's the 14th leading cause of death in the United States. So pretty common, pretty frequent. As we get older, it tends to be a problem that is more progressive in nature. Medicines help a little bit. They slow things down. But as of right now, there is no cure. And the reason to be aware of it is because if you don't catch it and you end up having it progress, it can progress much, much more quickly. So that's the main reason why you want to make sure that you know about this.
Yeah, my brother-in-law is a musician, and his manager has Parkinson's, got it very young, and we have a fundraiser, rather large fundraiser every year in New Jersey in January, and I see these people who have been affected by Parkinson's, and it's debilitating for many, many people. It's a very sad disease, as it progresses and gets to the point where people, can't even take care of themselves.
Yeah, and it affects everything. It affects their relationships. It affects their initiative. It affects every aspect of their life of what they used to be able to do. They just can't do it anymore.
Yeah. Well, it's good to bring it out in the open and let people talk about it. And I'm glad you mentioned the symptoms, because that's the kind of stuff people don't realize, what to be watching out for.
The biggest thing to be looking for is a resting tremor. That is the hallmark that we usually think of. And so it usually tends to be in the fingers, and it's at rest.
Okay, keep an eye for that. That's a good thing to do. Also, I know, Dr. Stan, you wanted to talk about, the supplements and the drugs and the things like that you can pick up at the convenience store, the gas station. Tell me about that.
Yeah, so this is something that is starting to become more and more of a dangerous thing. So for older people, we talked about Parkinson's disease. For younger people, let's talk about addiction. And so this tends to be most common among people between the age of 30 and 50, where at the grocery stores, at the drugstores, at the different convenience stores, gas stations, usually next to the energy drinks or to the cigarette lighters is where they're selling kratom. Now, kratom and male enhancement drugs and this thing called tianeptine, they can be purchased. They're not controlled, but they're very, very dangerous for quite a few people. And they can make you become intoxicated and very, very easy to become addicted to it. So part of the whole issue, and there are three slightly different things, but kratom, it comes from Indonesia, Malaysia, South Asian countries, and originally it was used to treat stomach ailments, hypertension, infections. But what it can do is it can give you this intoxication effect. It's a psychostimulant, and at low doses, most people begin to feel a little bit of a buzz. At higher doses, it's exactly very similar to what you would get with opioid, and there are some people who started with one and then went up to 2 or 3. I had one patient that was spending $1,000 a month because it was so highly addictive. So kratom is not a safe medicine or a safe substance for a vast majority of people. And if you find yourself just craving kratom, get in to see your healthcare provider. We're now using medicines like naltrexone to get people off of this medicine, and it's more effective. The other things that are oftentimes there are the male enhancement medicines, and they basically are kind of similar to what you would get with Viagra. It's called Rhino 69 is the most common. And the problem is that people can really develop blood vessel changes with severe chest pain and headaches, and they can end up having blood vessel changes with it, and then you become addicted to it after taking it for any length of time. So kind of a dangerous thing, not a safe thing. You really want to talk it over with your healthcare provider. And then the last one is that tianeptine, which is also known as gas station heroin. And what it is it's kind of a cogener of the old antidepressant tricyclic drugs. And what it does is it increases a person's weird thoughts. They end up getting similar to poison control, and it oftentimes is used with alcohol, and it makes people have more of an alcohol-associated reaction. All of these three can very quickly go from nothing to a severe addiction. So these are things that, just because you can find it over the counter doesn't mean it's safe. And if you are suffering with this or a loved one is starting to use this, get in to see your healthcare provider. There are things we can do to really help this to improve.
Yeah, so that's way too easy for people to go in and pick up, for sure.
Oh, my goodness. It really is.
All right, Dr. Stan. Well, we will have another conversation next Wednesday. How's that sound?
Hey, that sounds great. Great talking to you, Pam.
News, sports, traffic, and weather all morning long on your home of local news.